Hello, my name is Dr. Matthew Christian. I am a urologist in Southern Ohio, and I just wanted to make a small video with a case presentation and description of a new surgical procedure I'm offering, which is Holmium laser enucleation of the prostate. Our patient is a 70-year-old gentleman who presented to the hospital with urinary retention and renal insufficiency. In workup, he had a CT scan which showed an enlarged prostate at 125 milliliters. Initially, a urinary catheter was placed, and eventually his renal insufficiency did resolve. He attempted to undergo a voiding trial, but he was not able to pass this, and then ultimately decided to undergo surgical intervention for his enlarged prostate. Looking at surgical options for the enlarged prostate, the American Urologic Association guidelines provide some recommendations to decide upon which surgery might be best based upon the patient's prostate volume. And this is becoming more important. So you will see we group prostates on a small size, average size, and large. Our patient ended up being in this large group, and so what you will notice is that Holmium laser enucleation of the prostate is a size-independent option for patients. Other similar options would include HoLEP, which is a different type of laser called the Holmium laser. Now, going back to other options within the average size prostate, lots of different options out there, which would include PVP, which is green light laser photovaporization of the prostate. PUL stands for urolift, and then the sort of long-term standard, which is the transurethral resection of the prostate. So, prostate anatomy, the prostate consists of essentially three zones. You have your transitional zone, which is this central portion here, and that is what ultimately leads to the obstruction in men. There's a peripheral zone, and then up top here would be the anterior fibromuscular stroma. So what is a HoLEP? It essentially mimics the technique of an open simple prostatectomy or a robotic simple prostatectomy. Essentially, the prostate is hollowed out down to its surgical capsule. We do more of an outside-in approach, so you're working these outer areas of the prostate rather than going down the middle of the prostatic urethra and cutting away like you would for a transurethral section of the prostate or even a laser vaporization of the prostate. So essentially, you're finding the vessels once, you're coagulating them once, so bleeding tends to be a bit less. And then once you hollow out all this prostate tissue, you do have to remove it. So we use a device that fits through the scope called a morcellator. So this is all a natural orifice surgery. There are no incisions on the body. We do this all transurethrally. So this is the patient's pre-operative CT scan. We'll just zip through it quickly here. What you'll notice are the kidneys, looking very distended with urine. This is the bladder, which is quite distended, and he has a very large prostate. It's pretty impressive to see how dilated the renal pelvises are on both sides, and then certainly how distended the bladder is here. And so we'll kind of leave it paused there. So this is the patient's post-operative CT. We don't routinely get post-operative imaging. I do not remember the exact indication why this patient had the CT scan, but ultimately it does give us a nice view of what his prostate looks like afterwards. So you'll notice that the kidneys are nicely decompressed. The urine is draining out of both the kidneys the way it's supposed to. And then the bladder is decompressed here, and the prostate's much smaller. Can I get back to that real quick here? So there's the prostate. So just a dramatic reduction in the volume of the gland. So the patient ultimately underwent an uneventful Holmium laser enucleation of the prostate. His final pathology showed a 95-gram resection. All the tissue was benign. And initially his CT scan showed an estimated prostate volume at 125 milliliters. So we were able to remove the vast majority of the prostate. He's currently voiding well. And so if anyone is interested in learning more about this, I do see patients in Southern Ohio. I have offices in Ross County, Fayette County, and Highland County. Thank you very much for your time today.